Good afternoon and welcome to United TV. My name is Kemal Erkan. Obesity isn't just about the numbers on a scale. It's about a complex web of health challenges it brings. From diabetes and hypertension to sleep apnea and joint pain, obesity casts a long shadow over our well-being. But what if there's a beacon of hope in this shadow? What if bariatric surgery, with its potentials to shed excess weight, also offers relief from these burdensome comorbidities? Today, we are going to dive into a fascinating topic of resolution of the comorbidities with bariatric surgery, and we will untangle science behind bariatric surgery and its impact on various comorbidities. And I have our expert, Dr. Isaias Irgau, with me. Dr. Irgau, how are you doing?
I'm doing great, Kemal. Glad to be back on yet another wonderful Bariatric Friday session.
Absolutely. So last week we discussed the risk of bariatric surgery and risk factors for bariatric surgery. This week we are focusing on resolutions of comorbidities. As I was telling in our introduction, there are so many other illnesses. We call comorbidity. You don't like when I do comorbidity, when I call it comorbidities, but let's call them other illnesses alongside with morbid obesity. And one of the, I guess, very effective part of this powerful tool, bariatric surgery, is the impact, the changes that we see in other illnesses that person may be having. And as an expert, you are going to tell us what you see, what you have seen with your patients, and what are the other help of bariatric surgery. So that's what we would like to discuss.
Absolutely, absolutely. Kemal, if you look at the top causes of mortality in our country, in the United States, you will see at the top cardiovascular disease, which includes heart disease, high blood pressure, stroke. You will see metabolic diseases, which include things like type 2 diabetes. You will see cancers, right? And surprise, surprise, obesity is closely related to the development of all these major causes of disease as well as death in our country, right? So it is no surprise then that people who have morbid obesity also tend to have a shorter lifespan, because with obesity we have a concurrent disease, including high blood pressure, as you mentioned in your introduction, type 2 diabetes, and other illnesses, including cancers, right? So interestingly, the existence of these diseases alongside obesity is not coincidental. It's actually causative, right? Obesity actually, as a disease, causes these other illnesses as well.
Mm-hmm.
I mean, we can look into the scientific reasons for that, but without that, we can just do observational studies, right? You have about 3 out of 4 patients who have high blood pressure are obese patients, right? In about 90% of cases, type 2 diabetes is caused by obesity, right? So there is such a close correlation between the existence of these illnesses and obesity that it is no surprise that when we focus on obesity as the main culprit and get rid of it, Kemal, we see resolution or improvements in these other illnesses as well. So before really the popularization of bariatric surgery the way it is now, especially among healthcare workers, right? Among the general population, there is still not enough knowledge of bariatric surgery. And that's why I'm so thankful for you having this session has come out, because we want to get this information out. But among healthcare workers, the understanding of this miracle cure that can take care of many illnesses in one go has taken hold now, right? So 15, 20, 25 years ago, you would go to see a doctor, right? And they would measure your blood pressure and say, oh, you have high blood pressure, right? Here is medication for it. And then they send you for blood work and they find out that your blood sugar is too high. Oh, you have type 2 diabetes. Here is medication, right? Oh, you are very tired during the day. Oh, let's check for sleep apnea. You have sleep apnea. Here is a machine to take care of it, right? Let's do screening. Oh, we've done mammogram, you have breast cancer. We've done colonoscopy, you have colon cancer. And yet, with all that, the discussion about obesity, which is right front and center, was not there in those days. Come on, right? Now things are changing. Healthcare doctors really are understanding that the central problem is obesity. So when they see a patient who has morbid obesity, rightly, they focus on that. And then they explain that the high blood pressure, the type 2 diabetes, the sleep apnea, the risk for those cancers is actually related to it. So addressing obesity will also address all these illnesses. So it is very, very important now to understand that when patients have high blood pressure, they are also at risk for many other illnesses, Kemal. They are at risk of heart disease. They are at risk for stroke. They are at risk for kidney disease. And kidney failure and dialysis are terrible problems that are extremely difficult to treat, right? Similarly, if you take type 2 diabetes, there is actually a crossing of lines here because you see also patients with type 2 diabetes at high risk for stroke, for heart disease, for kidney disease, not to talk about the other problems related to type 2 diabetes. Right? Now, how does obesity cause all these problems? When it comes to type 2 diabetes, Kemal, obesity causes diabetes because of the resistance to insulin. The person is able to produce insulin as opposed to type 1 diabetes where the person is not able to produce insulin, right? In type 2 diabetes, actually the person is able to produce insulin, at least at the beginning. But that insulin does not work because of the resistance caused by the presence of excess fat. So excess fat is not a passive tissue that stays there, right? It's actually a very dynamic endocrine organ that produces substances that are counter to the health of the person because they will affect their ability to utilize insulin, but also they will affect in a negative way their ability to have a healthy blood pressure. So obesity is the cause of these problems. So we are not surprised when, as bariatric surgeons, Kemal, we do bariatric surgery, which leads to weight loss, and patients no longer require high blood pressure medications. Patients may no longer require medications for type 2 diabetes. There is resolution. So as physicians, as doctors, as healthcare professionals, Kemal, when we are doing bariatric surgery, yes, we want that weight loss. Yes, we want the person to be happy and comfortable with their body, but we are focused on those illnesses that that person is carrying alongside obesity. And we are able to treat that. So resolution of comorbidities is one of the great, really, achievements of bariatric surgery, of course, beyond improving the person's quality of life.
So one of the tools that we use in science is the root cause analysis. We do this in the business and other places as well. And it seems like, as you were mentioning, in this specific part of the chronic illness domain, it's easy not to maybe follow that. And then, if morbid obesity doesn't have to be treated, while actually it is the root of many of those problems. So now I just want to kind of give some specific examples. Someone may have diabetes, and diabetes may be related to nephropathy, or it may be related to other things, right? So someone may have, it may be related to kidney failure, as I was saying. So there may be hypertension. Hypertension may be related to, again, kidney problems or actual heart disease, which makes the problem bigger, more severe. So those are, it's not like one creating the other one. It's almost like they are actually created, like that's already, this is related to this other problem. When it comes to morbid obesity, it's on the foundation of these where the start of these problems are. So then you have that, then it's going to be easier to just have all these other problems developing, and including the lifespan and all that. Now, we have one of the other things that I want to explain, Dr. Ergau, is the multidisciplinary program that we have. Like some people who are watching this, they may be seeing this as like this is a marketing tool for more bariatric surgery. But the truth is, well, yes, maybe we are going to take that. But the other big benefit of it is that it's educating those individuals and making them understand what the program that we have in place. So when we say, well, this tool, bariatric surgery, is so effective, so efficient that it's going to help you with X, Y, Z, they're going to say, well, how do you know, right? Now, part of the multidisciplinary program, part of our program itself, after the surgery is done, our job with the patient is not over yet. So from our accreditation standpoint, we have 5 more years to report our numbers to the nationwide database, and which actually includes these comorbidities, these other illnesses, and resolutions of those, if there is a resolution, if the patient comes back and if they still have those issues. Of course, we have to report as, yes, they are still having those issues, but when we know that they are no longer taking their diabetes medication, their hypertension medication, and because the problem that they have is resolved, so that's what we report. So there is a very significant work that we have to do to get this data for our patients. So the reason I'm saying that is because when we look at diabetes, so the resolution rate is almost 83%. For cardiovascular, it's 82%. Sleep apnea is about 75%, and hypertension is about 73%. So these are really big, powerful numbers, and this is happening. It's not like, it's happening for some, it's not happening for some. These percentages are not 10, 12, 15%. These are very strong outcomes, and we want to make sure that this is kind of clear for those who are dealing and fighting with morbid obesity. Dr. Ergau, can you talk about that process a little bit? The things that you see after patient comes back 6, 7, 8 months after the surgery, what you have seen in the last 20 some years?
Absolutely, absolutely, Kemal. What we see is joy, right? Patients are really liberated from many of the illnesses, beyond feeling great because now they don't have to carry, an extra 60, 70, 80, 100 pounds, 24 hours, 24/7. Besides that, they are very, very happy because of the improvement in their health. Their blood work is pristine. They don't have to take medication. They may have been on medication for type 2 diabetes, for high blood pressure, and other conditions, and now they don't, right? Very often, one of the most common calls we get after surgery, Kemal, is patients saying, oh, I'm feeling dizzy, right? This is a few weeks after surgery. And the first question I ask them is, are you still taking your blood pressure medication? And invariably, the answer will be yes, right? So the patients who have been on blood pressure medication, that medication was bringing the high blood pressure to normal blood pressure, right? Now they've had weight loss surgery. They don't have high blood pressure anymore. They have normal blood pressure, right? If they take medications, what's going to happen to their blood pressure now? It's going to bottom, right? Now their blood pressure is too low and they're going to feel dizzy, right? So what I tell them is, look, now it's the time for us to review your blood pressure medications, right? So stop taking them today or decrease them, and then call your primary care doctor, call your cardiology, or the doctor that had started them on that medication. In fact, very often what we will tell our patients, Kemal, is to make an appointment with their primary care doctor within the first few weeks after bariatric surgery, because adjustment of medications will invariably be needed, right? And that is because now there is improvement, right, in their illnesses. The same thing with their blood sugar, right? Type 2 diabetes patients, as you may recall, Kemal, they have to check their blood sugar on a daily basis, right? They're taking medications. Sometimes it's more than 1, more than 2 medications. Sometimes they may even be on insulin if the type 2 diabetes has been with them for many years, right? So they have to check their blood sugar according to the guidance that they have from their primary care doctor or from their endocrinologist, right? Well, after bariatric surgery, sometimes within days after surgery, right? And for certain procedures like gastric bypass, Kemal, even the next day after the operation, their blood sugar may normalize completely, right? So that's what we see. In fact, one of the greatest papers that was published about 20 years ago, a little bit less maybe, by Dr. Walter Poirier in South Carolina, Kemal, was entitled how can one operation treat type 2 diabetes, right? And he showed in his series of, many patients that he'd operated over many years before bariatric surgery was popularized, that there were patients who were coming to hospital on insulin, that they had type 2 diabetes for years, and then they would walk out of the hospital free of insulin because their blood sugar had normalized. And one of the things I would like to highlight today is that with bariatric surgery, actually the same mechanisms that lead to weight loss actually influence the metabolism of the person in a beneficial way. So there is almost like an independent improvement of things like type 2 diabetes just because of the procedures. So much so that, Kemal, that right now, there are places in the world, not yet in the United States, places in the world where bariatric surgery, particularly in the form of gastric bypass, is being offered as a first-line treatment for type 2 diabetes, independent of the weight of the people, right? So you can have people with a body mass index of 27, 28 with type 2 diabetes. They are being offered gastric bypass as a definitive treatment. And why is this happening? This is happening because for many people, type 2 diabetes is a never going away illness. It's an illness that they will take to their grave, right? It's chronic problem, right? And even with the best control, with the best medication, is the risk of amputation, the risk of blindness, the risk of kidney failure, the risk of heart disease or stroke remains with that person when they have type 2 diabetes. That's why many doctors are advocating the use of metabolic surgery. That's how they call bariatric surgery, even in instances where the weight issue is not that much great, right? So when we say if you have obesity, if you have morbid obesity and type 2 diabetes, bariatric surgery should be something you need to look into. Bariatric surgery should be something your doctors should be asking you to consider, is because it's based on that, Kemal, because we are able not only to liberate that person from the burden of obesity, but also these very, very dangerous illnesses like type 2 diabetes.
And one of the really common comorbidity is also depression and anxiety. And unlike hypertension and diabetes, in many cases, patients are not looking for help on the depression and anxiety related issues. So we see there's a lot of improvement on the depression and anxiety. Can we talk about that a little bit?
Absolutely, absolutely. You see, with depression and anxiety and similar, problems with mental health, Kemal, obesity plays a major role. And the reason for that is almost like there is a vicious cycle where the person can enter, right? Yes, there may be depression for a number of reasons, and very often people, just to feel better, they may actually go to food as their first recourse, right? And that creates and worsens obesity, and that obesity itself as a burden creates more sense of unhappiness in a person, right? So we see very high rates of depression among our patients as well as anxiety. And then because they are not able to break that cycle, there is really worsening of obesity. And then to make things even worse, Kemal, depression is treated with medications that encourage even more weight gain, right? Which by itself is going to make the depression worse, right? People who have depression and anxiety may have sleep disorders come up. And we know that sleep disorders also worsen obesity, right? If a person is not able to get good sleep, if they are up at night, they are more likely to snack, they are more likely to worsen their obesity as well. So it is a vicious cycle, really, that is very, very tough for people to get out of. And bariatric surgery is actually able to break that cycle very often because it gives relief to the person. The person is able to get out of obesity. They're able to become much more self-confident. And we've talked about that. We've talked about how stigmatization of a person because of obesity can lead to isolation, can lead to decreased self-confidence, and also worsening of obesity. So yes, we see people a lot happier after that. Kemal, they tell us, the one thing I regret about bariatric surgery is that I haven't done it any sooner than I have suffered it for so many years unnecessarily. So yes, absolutely. Obesity, anxiety, other mental illnesses that are really impacted by lack of self-esteem are improved tremendously after bariatric surgery. Yes, having said that, it doesn't mean that everybody who's struggling with mental illness will actually miraculously get better after bariatric surgery. Of course, that's not the case all the time. And that is why we also, as part of our multidisciplinary evaluation, actually we include a psychological evaluation, Kemal, and a follow-up with psychology as well. And for patients who are seeing a counselor, we actually highly encourage them to make sure they discuss their issue of bariatric surgery with their counselor, and they make sure they continue to follow up as well to really cope with the changes that come after bariatric surgery. But yes, you're absolutely right. Depression and anxiety rank very high among the illnesses we see with obesity, and they are also the things that improve greatly after bariatric surgery.
So, Dr. Ergau, we did introduce this, I believe, last year or the year before, cancer and how bariatric surgery can help those who may be dealing with cancer, or in the future they may be dealing with it, or while they are having it. Can we also discuss the relation to cancer, how post-surgical benefits patients are having?
Absolutely, absolutely. Kemal, we've made huge strides in the treatment of cancer, right? Definitely many things that were very difficult to treat in the past are way better now, right? But one thing that we have understood about cancer, even from the very, very early days of really understanding this disease, is that prevention is by far the best way to go, right? And that's why we have mammograms, on a repeated schedule for women above a certain age. That's why we have colonoscopy as something that needs to be done after a certain age for everyone, right? Because we want to catch cancers before they arise, right? One thing that we have really discovered in the last couple of decades, Kemal, is that many cancers are actually much more likely to happen in the setting of obesity, right? So obesity itself as a condition can become a risk factor for cancers, right? And this is important. This is important. The reason we had a huge campaign against smoking for many years and have resulted in such dramatic decrease in the number of people who smoke, Kemal, is because we understood the link between smoking and lung cancer, right? It was important to understand that. And now that we are understanding that there is a link between obesity and many types of cancer, whether it's breast cancer, colon cancer, uterine cancer, Kemal, we are absolutely focused on this as well. And we're saying, look, if you are remaining obese, if you are remaining morbidly obese, your risk for these cancers will also increase. So not only you will have a risk for high blood pressure, sleep apnea, type 2 diabetes, joint pain, back pain, migraines, all sorts of problems that affect all types of organs in your body, but also the risk of cancer is increased, right? So reducing obesity reduces the risk of cancers as well. And this has been shown in many population-based studies, Kemal, where they have actually demonstrated the decrease in the risk of cancer after patients have had bariatric surgery and successfully have lost weight. So it is important. Of course, you have to continue your other good behaviors and your other preventative measures as well. So for women, they have to continue the recommended schedule of mammogram, the recommended schedule for colonoscopy should continue for colon cancer as well. But when people are struggling with obesity, focusing on weight loss will reduce also their risks for these cancers as well.
So we discussed diabetes, hypertension, sleep apnea, high cholesterol, joint pain, reflux disease. We did cover that in some of our other sessions. Depression. So these are really big diseases that we can actually prevent or we can better manage. So that's kind of like the idea is, one is someone may go through these anyway, but then you have to be in your best kind of like shape in terms of your body so that you can handle some of these in a better way. Again, if you are not prepared, the things are going to be more difficult. And the results are going to be more severe. But if we can kind of prep for what's coming, then we are ready if those things are going to happen to us at some point. So not to take advantage of this would be almost like a crime. So
absolutely. Kemal, before we move on, I would like for us to spend a little bit more time on type 2 diabetes, right? Because the correlation with obesity is so clear, right? If you kind of stop and think, right? Type 2 diabetes is one of the top 10 leading causes of death in this country, right? People who have type 2 diabetes have a twice as much risk of dying of any conditions as somebody who doesn't have it, right? And then if you are obese, you are 10 times more likely to have type 2 diabetes, right? And type 2 diabetes, as we said earlier on, is really related to very many conditions, right? You can lose the blood supply to your legs and have amputation. You can lose, you can have problems with your kidneys and end up in dialysis. You can have a stroke. You can have heart disease. You can have blindness, a plethora of problems related to this, right? If we look at the rise of obesity in the United States, right? Actually, there are very, very beautiful geographical maps showing the prevalence of obesity in the United States starting from the 1980s and being updated every 5 years. And it shows that obesity was very low in its prevalence, in the 1980s, and then it's almost 30% in most states in the United States. Very interestingly, the incidence of type 2 diabetes marches along with it. Right? As you see a rise in obesity, you see a rise in type 2 diabetes as well. Worldwide, the same thing, Kemal. I don't know if we talked about this last time, but the World Health Organization announced a few weeks ago that the rate of obesity in the world has reached 1 billion, Kemal, right? And there are places in the world, Kemal, where type 2 diabetes was an unknown disease until recently. As the rates of obesity started to catch up in those countries, type 2 diabetes started to come on as well. So there is no question that there is a clear correlation between obesity and type 2 diabetes. And addressing obesity makes so much more sense, right? And the best way to address it with morbid obesity, the most effective way, is bariatric surgery. Not only because it's effective at getting people to lose weight, but also because it's effective at addressing the main pathophysiology of type 2 diabetes, right? As I was saying earlier on, with certain bariatric procedures like gastric bypass, for instance, Kemal, you can do the procedure, and before the person has lost an ounce of weight because of the surgery, you see their blood sugar dropping, right? And normalizing, which means that the bariatric surgery itself is actually a way of treating type 2 diabetes.
So it's kind of like the key here is you mentioned it earlier, and these are also learning, including myself. I'm also, every time we do these sessions, I pick up something new. Although we are hearing the same thing, maybe you've been saying the same thing, but then today is there's the day that I'm able to actually hear something maybe differently and understand something more. So for those with the type 2 diabetes, as many patients can see this significant change before significant weight loss after the surgery. That means there's some structural improvement that they benefit from the bariatric surgery. So your example of someone with 27 BMI 27 who has severe type 2 diabetes that's not controlled, then that person actually still can benefit from it. So they don't need to be morbidly obese. So this is kind of really emphasizing, highlighting how important, how powerful this tool is. And also there may be some other things that we don't still understand today that is still gonna come to in the future. So there may be some other things that we still don't know today, but what we know is enough to actually take advantage of. Now, when people are looking for the world's ranking in terms of morbid obesity and obesity, that may be a little bit deceiving because the first country, I don't know what that country is, Tuvalu. So I like 57%. So, cross that out. The second one is Samoa. I don't know where that is.
The Pacific, islands.
Somewhere there, right? So they're not so significant in terms of the population. United States is number 10 right now with 41.64% obesity rate. So that number is extremely high, and that is alarming for the future. And that's why we want to make these sessions available for those who are dealing with obesity and morbid obesity and better understand the disease itself. So, Dr. Erkan, thank you. This Sunday, today is a Good Friday, and this Sunday is Easter. So, those who are celebrating, of course, Happy Easter. Like, no matter how long the winter is, spring is sure to follow. So, Happy Easter for those who are celebrating. And we'll be back next week with another topic. And until then, we'll see you soon. Bye-bye.
Thank you. Bye-bye.